Welcome to Friday's edition of COVID-19. Officials are on high alert amid expectations of greater public movement starting today to mark the Chuseok holiday, which falls on the 21st of September this year. Now, we have more on this reality later on the program after a look at the pandemic updates with our Kwon So-ah. Now, So-ah, how are we ending the work week and starting the long weekend into Chuseok?
Well, Sunny, not really on a positive note, but maybe the figure will help in people to stay vigilant. We've got 2,008 infections reported as of 12 a.m. this Friday, which includes 1,973 domestic cases and 35 imported infections. With that, Korea has accumulated 281,938 total infections with 2,389 fatalities. Now, for the first time in a month, the country is observing over 2,000 cases on a Friday. And also, if we compare the figure to last Friday, that is quite an on-week spike. And this spike is especially concentrated in the greater Seoul area, which made up 77.6% of domestic transmissions as of 12 a.m. this Friday. So for a closer look at our map, these increases are being seen in the capitals Seoul, Gyeonggi-do Province and Incheon. But also, the government mentioned that there's been a rise in the center of the country in Daejeon, as well as Chungcheong, Namdo Province, which reported over 50 cases this Friday. And also, apart from Jeju Island, now all places are seeing at least double-digit figures of infections. Despite this surge, though, beginning this Friday until next Thursday, family gatherings of up to 8 people will be allowed for people in the metropolitan region and other places under level 4 social distancing, and that as part of Chuseok holiday incentives. But this will only be allowed if out of the 8 people, at least 4 people are fully vaccinated and only at home settings. Now, also what's starting on this Friday is the surplus of vaccine program here in the country has been expanded to the second shot. So people who have already received their first shot can make extra applications to receive the second shot. And the span for Pfizer will be between 3 and 6 weeks, for Moderna 4 to 6 weeks, and for AstraZeneca between 4 and 12 weeks. Now let's move on to the latest figures of vaccinations. As of 12 a.m., 69% of the nation's population has received at least one shot. So we are expecting that 70% milestone to be reached this Friday. Let's move on to some global updates here. The U.S. is still dealing with increasing figures, a total of 42.6 million, over 33.3 in India. And we're also seeing here Spain and Colombia soon approaching the 5 million mark in total infections. And around the globe, as of noon Korea time, over 573,600 people have been infected with the coronavirus. And those are the updates I have for now, but I'll see you back in a bit. Sunny.
All right, So thank you for those figures. Right, there have been reports of COVID-19 infection among expecting mothers here in the country in recent days. And for more on this, I have our Kim Sang-yeon here in the studio with me. Sang-yeon, welcome.
Good afternoon.
First, and just last week, Sang-yeon, a woman with COVID-19 gave birth to a healthy baby, I hear.
That's right, Sunny. The new mother was in her 30s and had tested positive with COVID-19. The woman had been infected by a family member and had to get an emergency C-section at a hospital after her water broke last Tuesday. Now, Ulsan University Hospital in southeastern Korea announced last Wednesday that the woman had safely given birth to a healthy baby girl. Her surgery took about an hour at a negative pressure operating room to keep the virus contained. Following the surgery, the mother and her baby were kept at separate isolation wards to eliminate any chance of infection. Ulsan University Hospital says their hospital is the only medical facility in Ulsan with a negative pressure neonatal intensive care unit, and that it was working to keep both the mother and her baby girl healthy until they're ready to leave the hospital. And in a separate case, another mother in her 30s with COVID-19 safely gave birth to twin babies, also via C-section, on August 9th at Joseon University Hospital in the southwestern city of Gwangju. The 32-year-old had been diagnosed with COVID-19 just a week before. The medical staff installed a portable negative pressure device at the operating room, and the surgery team all wore level D protective gear during the procedure. There was concern that the mother could have passed on the coronavirus to her twins, but both babies tested negative on 3 separate occasions.
Right, well, that is good to know. Meanwhile, how severe, Song-yeon, are these infections among pregnant women and their newborns?
Well, so far, thankfully, there have not been any reports of serious illnesses among pregnant women and newborns with COVID-19 here in Korea, but they are still classified as high-risk groups nonetheless. Now, what's also concerning is the close contact environment seen in many postnatal care centers across the country. Just this past Sunday, a cluster of infections broke out at one such facility in the city of Guri, just east of Seoul, showing how vulnerable those places can be.
The first infected case was reported on the 12th in a mother. And on the next day, 5 newborns were confirmed with COVID-19. There were 14 mothers and babies at the postpartum care center during that time.
Physiological changes in pregnant women mean they are at greater risk of being infected by the coronavirus, as well as developing severe pneumonia and neonatal complications from COVID-19. A recent study by Canadian researchers suggests that expecting mothers face a broad spectrum of heightened risk, ranging from serious illness that require hospitalization, ICU admission, or even life support.
Which is probably why health authorities here are recommending COVID-19 inoculations for expecting mothers, Song-yeon.
That's certainly right. The KDC announced 2 weeks ago, Sunny, that it is in favor of vaccinations for expecting mothers, which may become available sometime in the fourth quarter. Now, KDCA Commissioner Chung Eun-kyung said that after consulting with experts, the government is looking to offer mRNA vaccines from either Pfizer or Moderna to pregnant women in the fourth quarter. The chair of the board of the Korean Society of Obstetrics and Gynecology said while the government has given the nod, it remains uncertain how many pregnant women in Korea would actually want to be vaccinated, with many of them anxious about how vaccines could affect the health of their babies. Now, one health expert, however, said not getting vaccinated would put them at higher risk of COVID-19 infection with dire consequences.
Contracting COVID-19 during pregnancy could be dangerous to both the mother and the unborn baby, and I therefore strongly recommend pregnant women to get vaccinated.
Last month, the U.S. CDC also urged all pregnant women to get the COVID-19 vaccine and also extended its recommendation to breastfeeding mothers as well as women who are planning to have a baby. Several studies also suggested that there is no evidence of pregnant women being at higher risk to adverse reactions after getting vaccinated.
All right, Song-yeon, as always, thank you very much for that coverage.
Thank you for having me.
Right, officials here have reaffirmed their dedication to containment efforts as Korea looks to kick off its long weekend to mark next week's Chuseok holiday. For more, Soa joins me now at the desk. Soa.
Hi again, Sunny.
Right, so authorities are on high alert then.
They are, and especially because we are heading into the Chuseok holidays with over 2,000 COVID-19 cases. And despite the number, though, Prime Minister Kim has mentioned that there are more people expected to travel over the Chuseok holidays than during the holidays last year. And also he stressed that our fight against COVID-19 is still very much underway. Here's his message.
As we've seen around 80% of cases being confirmed in the capital region for many days now, there are concerns that it could lead to a balloon effect in the non-capital regions due to mass holiday travel. We must avoid a repetition of the painful experience we had of a nationwide spread during the summer vacation season in late July to early August.
The difference from last year is, of course, that now we are having much more people vaccinated with COVID-19 compared to last year, which is why the government is being more flexible when it comes to family gatherings this time around. However, as Prime Minister Kim said today, this is what people should keep in mind nevertheless.
When meeting with family members with whom you do not live together, make sure to keep your gatherings as small and as short as possible. We also ask you to wear your masks, regardless of whether you are indoors or outdoors.
Right, and to ventilate our indoor spaces, of course. Now, so I hear we're looking at some extensive efforts by authorities and frontline medical workers to keep the COVID-19 situation under control during the 5-day holiday.
That's correct, Sunny. Officials this Friday laid out their plans on how to control the virus situation and provide care to patients throughout the Chuseok holidays. At an earlier briefing, a health ministry official said that 507 medical facilities that have emergency rooms will be operating 24 hours a day as usual. Even on the day of Chuseok, which falls on the 21st, 234 public health care centers are expected to be in operation. Also, an average of 544 COVID-19 test centers are to be open during the holiday period. Apart from 13 temporary testing facilities at bus terminals, train stations, and expressway rest areas, the government decided to add 4 makeshift centers at highly visited traffic hubs. Even if you have mild or no symptoms, officials are encouraging people to get themselves tested for the virus before and after the holidays. And also, the government has said that it will be providing free services for video phone calls for those families who choose not to get together over the Chuseok holidays. And they will also have free services of culture content on some portals so that people can watch exhibitions or performances or concerts during that holiday if they choose to stay at home.
Right. Meanwhile, on the vaccination front, so I understand officials remain quite optimistic about offering 1 dose to 70% of the population before the start of the Chuseok, which would be the 21st of September.
Right, Sunny. And from that initial goal, they actually believe that this Friday they are going to reach that goal. 36 billion people are expected to receive that first shot, according to many officials this Friday. So here's some more by a senior health ministry official, Lee on that specific forecast.
The global vaccination rate stands between 42.5 and 42.6% when it comes to the number of people who have received at least 1 dose. That figure for Korea stands at 69% and expected to reach 70% today. The rate in nearby Japan is slightly lower at 64.9%. The US is at 63.47%, while Israel is similar to Korea at 69%.
Now, you might be wondering, we're at the same page as Israel when it comes to vaccination. That's not correct when it comes to the full vaccination, of course. So we are at 69% when it comes to the first dose, just like Israel. But then Israel, for instance, has already more than 60% fully vaccinated and also is underway with its booster program. Now, why are we having this faster vaccination now for the first shot? Officials are crediting the nation's people for their cooperation when it comes to that front, but they now also have high anticipation when it comes to full vaccination. So let's take a listen.
The number of first doses administered is a lead indicator of how many second doses we can expect. With the second shot being administered within 6 weeks after the first, that means we can soon have 70% of the people completing their second doses sometime in the next 6 weeks.
Right. And as you mentioned, the surplus vaccines for second doses could actually speed up the process then.
Yes, we are expecting that as well.
All right. So thank you very much for those details.
Thank you, Sunny. Have a safe Chuseok.
You too.
Thanks.
Right. Now, beyond the containment strategies being adopted by authorities here, let's take a quick look at those being advocated by their counterparts in Europe. Our G. Abby Lee is here in the studio with details on that. Welcome, G.
Hi, Sunny. So in the midst of continued talks on vaccine equity around the globe, England launched its COVID-19 booster vaccination campaign on Thursday. Members of the National Health Service, or the NHS, received the first doses.
If I'm protecting myself, I'm protecting them. It's automatic. Because as a sonographer, we do not have the ability to social distance ourselves whilst working. We have the patients right up close to us, and we are a small team.
The rest of the staff at Croydon University Hospital in London said the booster jabs gave them confidence moving forward to the winter months ahead. Earlier in the week, British Prime Minister Boris Johnson outlined how the booster program for over 50s and other priority groups will be a key part of his plan for the rest of the year. Now, this is how it works. Booster vaccinations will be given at least 6 months after people receive their second dose of the COVID-19 vaccine. The schedule will be more or less the same as the original priority list, starting with the oldest, the most vulnerable, and healthcare workers. NHS England said the first rollout of booster shots to the community will begin next week. Britain's Joint Committee on Vaccination and Immunization recommended either one dose of Pfizer or a half dose of Moderna vaccine for the booster campaign.
Right, I see. Meanwhile, G, I hear Italy is moving ahead with plans to do something that the UK recently just scrapped.
That's right. So on Monday, we talked about how the UK scrapped the vaccine passport plan, but Italy is doing the opposite. Rome is making compulsory for all workers to have a green pass, a proof of vaccination, negative test result, or recovery from an infection. The measures are a first for Europe and some of the strictest in the world. Local media reports say anyone without a pass will face suspension from work. They could also lose payment after 5 days. Businesses and staff could face fines up to €1,500 if people are found to be working without a valid green pass. The new regulation is poised to begin in a month on October 15th. Green pass certificates for COVID-19 provided both digitally and on paper are already required to access train stations, cinemas, and restaurants in Italy. School staff are also required to show a pass, and some teachers have reportedly been turned away from work.
That's quite unfortunate. Let's cover one more headline, Jean. An American pop star, I understand, has stirred quite a buzz among vaccine skeptics.
Unfortunately, that is the case. So singer-songwriter Nicki Minaj said on her official Twitter account Monday that if I get vaccinated, that is, it won't be for the Met. It will be once I feel I have done enough research. I am working on that now. She was referring to the Met Gala, a star-studded fundraiser for New York's Metropolitan Museum of Art. Minaj, who has more than 22 million followers on Twitter, admitted that she was preparing for the MTV Video Music Awards 2021 held on Monday, but she had to pull out after catching the coronavirus. Minaj added her cousin in Trinidad will not get the vaccine after his friend was jabbed and became impotent. To help dispel her mistrust in the COVID-19 vaccines, the White House invited her for a direct conversation. Here is White House Press Secretary Jen Psaki.
We offered a call with Nicki Minaj and one of our doctors to answer questions she had about the safety and effectiveness of the vaccine. This is pretty standard and something we do all the time. It was a very early stage call at a staff level, staff to staff, and we weren't even at the point of discussing, or we're not even at the point of discussing, I should say at this point, the mechanisms or the format or anything along those lines. It was simply an offer to have a conversation and an early stage call.
Later, Minaj added that she would be willing to get the vaccine to be able to go on tours. That's all for me today. I'll see you after the holidays.
Yes, you will. G, have a safe holiday yourself.
Thank you so much.
Right, back on the local front, as my colleague Soa mentioned earlier, as part of efforts to contain the spread of the virus here in the Greater Seoul area, temporary screening centres have been set up at public transit venues to encourage travellers to seek testing before heading beyond the capital region. Now, our Chun Song-cho is out on location for more on that. Hello, Song-cho.
Good afternoon, Sunny.
Right, so Song-cho, where are you exactly?
Well, I'm at Susa Station in southeastern Seoul. So this is where the Seoul subway line number 3, the Bundang line, and the high-speed train SRT all intersect, making it one of the most visited transit stations in the capital city. Now, even after the onset of the pandemic, around 35,000 people passed through this station, traveling or commuting. And during the Chuseok holiday, we're expecting a surge in public transit riders, especially with those going on trips and visiting their hometowns outside of the Seoul city. But so as the Chuseok holiday begins, there has been a number of makeshift test centers established across the city, including the one here at Susa Station Square. So this one has been operating since September 1st, and here anyone can get their COVID-19 test for free. But remember, the test center only runs through the last day of September 30th. And like I mentioned before, there have been a number of test centers established across the city, including the one in Gimpo Airport, Seoul Station, and Nambu Terminal. There are even ones on Highway Express rest stops. So since a lot of people are visiting here, getting tested as many as 400 each day, let's talk to one of the officials here at the station. Good afternoon.
Good afternoon.
All right, so it's been over 2 weeks since the center has been set up, and it's really promising to see so many people are willing to get themselves tested. How has been the reaction from the public so far?
Okay, usually an average of 100 to 400 people visit a test center per day. Actually, a lot of customers are still using SLT, despite of the fourth level of social distancing. So the test center provides a sense of convenience to our customers, and they are satisfied with the fact that they could take a test easily at the station before going home.
All right, to protect the loved ones from the virus. Thank you so much for your answer today.
Yeah, thank you so much.
All right, so on the eve of the country's major holidays, we are in no way close to tamping down the latest spike in COVID-19. We need everyone's cooperation and participation if we want to quash the threat of the virus. Please do enjoy your holiday and send love and regards to your loved ones, family members, but do so in a safe and responsible manner. Or maybe you can come back to one of these centers if you show any symptoms. This has been Chun Song-cho reporting live from Susa Station, and back to Sun in the studio.
All right, Song-cho, thank you for that report, and do have a safe holiday yourself.
수도권의 유행이 줄지 않는다면 추석 연휴를 통해서 비수도권으로도 이런 증가세가 확산될 위험이 있습니다.
Korea is poised to celebrate its second Chuseok holiday amid the global pandemic, and authorities are seeking to ensure public safety as the daily tally hovers on the 2,000 level. For more, I have Dr. Kim Sintek from Institute Pasteur Korea. Welcome back, Dr. Kim.
Good afternoon.
Right, Dr. Kim, there you are. I also have Professor Lee Hoon-sang from Yonsei University. It's been a while, Professor Lee.
Good to be back here today.
Right. Dr. Kim, let's start with your assessment of the current COVID-19 situation here in the country ahead of the 5-day Chuseok holiday.
Well, first of all, I think we have to actually consider some current trend of the confirmed cases. First of all, we have more than 1,000 of confirmed cases more than 2 months. And just recently, just the number of confirmed cases in just roughly in between the 1,500 to the 2,000. And then I think this is pretty much just very stable, but it's not really but it is pretty just vulnerable to any external, just stimuli. And then we are actually talking about some basic reproduction number, R0, and this is a little over just a 1.00. And then this number is basically actually dependent on the many just the variables. And one of the variable is human behavior. And then just upfronting the some Chuseok holidays, our just the human behavior, especially when we travel and then just getting along with the people in our hometowns, will actually just determine the some reproduction number after the Chuseok holidays. But I think, compared to the some Chuseok last year's Chuseok, there are some changes. For example, like now we have the period actually dominated by the Delta variant. And then another thing is the vaccination rate. Well, fortunately, the good news is that now with the first shot is now we are approaching almost just 70%, which is much better than the last year. But then still, it's not the completing just the vaccination. So we have to just keep in mind.
To be careful.
Sure.
Professor, the Greater Seoul area accounts for around 77% of the daily infections, as announced by our SOA earlier on. How do you explain the rampant spread here in the capital region?
So I think there is a number of reasons that makes this situation possible. So in this situation, we are seeing that for the first time, the daily case has gone up to about the level of the 800 cases per day. And as for some of the major cause for those situations, I think it is because there had been the Delta variant spreading around, especially among the people in their 20s to 40s. In these age groups, the activity level is just higher than the higher age group population. And also, currently, the vaccination rate is much lower. And also, there must be a much higher level of the person-to-person contact activity level. So with this, it seems like the virus are spreading much faster, especially with this Delta variant in the community. And also, probably there is quite much of the residual virus amount in the community as well. And another aspect is there are increasing amount of the people where the contact tracing is somewhat difficult of finding where the source is. So with this situation, I think this situation will be continuing for the time being.
Right, and against that concern, Dr. Kim, authorities here have spoken about the possibility of a balloon effect, especially as a greater number of people here in the capital region plan to travel beyond this area. Do you share this concern?
Yeah, of course. I mean, this is something that you can actually just fully just expect it, because actually based on our prior experience, like a summer vacation and other just some long holidays. But then obviously just more travels are actually expected for upcoming just holidays. And then last time I just talked a couple times, but I want to just emphasize one more time, just the viruses follow just the people, not the holiday. So our just the behavior would determine the outcomes. And then we are actually talking about some of the vaccination, but we are also at the same time we are talking about some breakthrough infection even after the vaccination. And this is not really just completely new. And then also just according to not very recent, but some of the paper in the coming out just maybe just a couple months ago, that vaccinated people can be infected. That's actually based on the breakthrough infection. But also the vaccinated people, once they infected, they can transmit the virus to some naive persons. But some likelihood of such the transmission is very low, because once we just vaccinated, which means that although we are infected, we are not probably just showing any just severe symptoms, and probably because of some neutralizing antibody just circulating our body would just suppress the viral replication, which means actually just the virus titer would be very just lower compared to the unvaccinated person. But then the chance, what I'm saying is that still that there are some chances that the vaccinated people can be infected and then transmit those virus to the unvaccinated people, naive person. So then what I'm saying here in this case is that even after vaccination, we have to be very careful and then behave very responsibly. The one way that we can do that is the wearing masks and then the maintaining some physical distances.
Right, of course. Professor, as mentioned earlier, temporary screening centres have been set up at public transportation venues, including bus terminals and train stations, to fight potential spread. But test results are mostly available after 24 hours, Professor. So some are questioning the logic of these efforts. What are your thoughts?
It's a little bit tricky questions because certainly providing the testing itself may not prevent the spread. I think it is quite understandable that there is some question about the effectiveness of operating this kind of screening centers. But sometimes with a faster turnaround, sometimes the 24-hour testing result turnaround time can be shortened to maybe less, to about 12 hours. I mean, if it is done even a little bit faster. But I think the point is that testing itself will not prevent the spread, but just in case that the virus are spreading around, to other cities and outside of the capital cities, outside of the Seoul areas, if there is any of the people who are being infected who are traveling outside of the cities, then by providing this testing center at the bus station and or train station, it just will make it will enable the detection of the transmission cases much faster, and also I think it can provide some kind of comfort for the people who are traveling outside of a capital city of having testing accessibilities much easier when they are traveling around. And another aspect is there can be some of the people who might be promoting for the rapid testing kits, but I would be a little bit careful on that regards, because the overall specificity or sensitivity can be lower than the normal RT-PCR test. So right now, this kind of measure may not prevent the spread of the virus, but it certainly will enhance any kind of wider community transmissions with a faster response.
Right. Meanwhile, Professor Lee, what are your thoughts on the Chuseok incentives for vaccinated people, which allows some to travel to nursing homes to hold face-to-face meetings with their loved ones, and of course the gatherings here in the metropolitan region of up to 8 family members within household settings, of course, provided 4 are vaccinated. What are your thoughts on these measures?
Again, this is a little bit of a tricky question, because it's a little bit hard. I mean, there are not much of hard data to back up that having 8 people is how much is it different from having 4 people, and I mean having more people to be gathering may contribute in the spreading of the virus a little bit more, but I think right now the comforting fact is now we have much more people, up to 70% of the population, who have 1 dose of the vaccination in the country. But another aspect is the reality of the sustainability aspect of the social distancing. I mean, people had been under a strict social distancing measure for more than a year in the country. So I think the government is trying to slowly reduce the level of the social distancing within reasonable manner. So I think it is quite understandable policy gestures, and I think it will provide some room for people to go back to some level of normalcy. Now people are calling it with corona policy. But I think but I would be still very careful about how the government sending this message to the general public. This is just careful measure to reduce the social distance measure to a certain extent, but it does not mean that everything is okay and everything can be going to the normal, and we are free of all the COVID-19 risk. So while people can take this message as maybe they can enjoy some level of a little bit of normalcy, but still they need to be more careful about how they gather and how much of the people they gather.
Right. Dr. Kim, you mentioned this earlier, breakthrough infections. Now, quite a lot of those cases have been taking place at nursing homes. What do you propose to address this reality?
Well, the nursing homes and the senior person just care facility, actually, most of the people are actually just fully vaccinated. But then I think those people are sort of just some priority groups, or now it's just a vaccine, just a campaign. So now it's been several months after they just completing just the vaccination, which means that it's pretty just well proven, just the fact. I mean, most of the immunization, once the complete vaccination, the neutralizing antibody, it just wanes. I mean, but the other aspects of the immunity would be probably just maintained. For example, like some T cell memory and the memory B cell, things like that. But circulating just antibody, the level would will just decline, which means that those people are just more increasingly just vulnerable to the infection. But still, the vaccines that we are actually using right now is showing a very good just efficacy in terms of preventing the severe disease and then the death. So again, I'm just saying that, but those people are now just more vulnerable to the infection. So then one thing that we have to do for the upcoming just holidays, whenever just the family members just had some chance of just the meeting the older just the parents, I think they should just keep some precautions such as wearing masks and then just wearing probably some disposable gloves and then keep some distances. And then that's how then the people just can just prevent their loved the family members for these upcoming just short holidays.
Dr. Kim, do you suppose booster shots could be one option to better protect them? Because it has been about 6 months since our frontline medical workers and those in the high priority list group have received their doses.
Yeah, there's this is sort of just ongoing debate right now for the booster shot. For some like so Israel and in the case of the U.S., there are some opinions are sort of just divided between like the CDC and the White House and versus the FDA and then also WHO. And then obviously there is not much some scientific evidences for supporting the booster shot at this moment. Most of the results are based on some observational study, not for any strict clinical the testing or the trial. So maybe for some very high risk groups, for example like healthcare workers and then some immune-compromised people, and probably or some old people might be just eligible for the booster shot if they want to just prevent infection, not just the severe disease. For the severe disease, the second shot after completing second shot is just enough. But for the infection, they might just further needed. And also for some healthcare workers, in this case, there is no just evidence for any reducing severity. But still to just prevent the loss of workforce, for example, like healthcare, the system, they might need the booster shot. That's just one of the opinions. Yeah.
Right. And staying with booster shots, Professor Lee, as Dr. Kim has mentioned, there are conflicting views on the need for these third shots. Where do you stand on this debate?
Well, I think I would be pretty much agree with Dr. Kim on this regards. Right now, the Pfizer and some of the pharmaceutical companies are actually asking for promoting the notion of the booster shots. But as Dr. Kim said, the WHO and FDA they are not quite agreeing with the notions. I think here the important aspect is the larger level public health impact consideration as well, because as Dr. Kim said, with this booster shots, as time extends, time period extends, maybe the antibody level may decreases, but the T cell memory function may be sustained a little bit more. So while there can be some level of the breakthrough infections on the population level, I think what the WHO and FDA are saying is the aspect of preventing death and severe development of severe cases are quite enough with the current 2 doses regimen. So 2 doses recommendation. So at the moment, especially while quite a large amount of the global populations are not having even the first shot, especially in the Africa and in many of the Asian countries. So in these situations, I don't think we have a lot of luxury to afford the booster shots for the global population and to have it as in the recommendation by FDA and WHO.
Right. Dr. Kim, staying with vaccination efforts then, starting today, as we mentioned at the start of our program, people already registered for the second dose can sign up for surplus vaccines. Now, initially, only people who had yet to receive even 1 dose could try their luck at surplus vaccines. Why has there been a change in policy?
I think the the reason is the easy guess is that now just the vaccine is being just supplied more just a predictable manner than just before. So that's some surplus issues. And also the second issue is I think is there is some obvious benefit by just completing vaccination. after the, I mentioned a couple of times, but after first shot and the second shot, especially there was some report comparing the Alpha variant and Delta variant. After second shot, obviously just protection efficacy was substantially increased. So then that was actually just one of just additional just fact. And then, in this, even after in this case, we are actually just trying just keep some minimum interval between just the first shot and the second shot. When the some Pfizer and the Moderna, they are actually trying just the clinical trials, they actually suggest 3 and 3 weeks and the 4 weeks. So that kind of a period is actually set to just just try to vaccinate more and more people. But just a longer period, it just interval actually does not just damage it so much about the some protection efficacy of the vaccination. But this is sort of just a minimum, just a period of just interval between the first and the second shot.
I see. Meanwhile, Professor Lee, what are some key facts to keep in mind as those who seek surplus vaccines as their second dose should keep in mind?
Well, just to get the vaccines as soon as possible when they get a chance, and not to care too much about the type of vaccines. As I said before, and as many of the experts said, the best vaccine is the vaccine that you can get right now at the moment. So just do follow the schedule, and when you make the reservations for the vaccination, please do not avoid and please let's not make any kind of vaccine to go waste. Get the vaccine when you get the chance, and just to have less of the worry about the type of vaccine you get. You will be safe. You will be on the much safer side as long as you get any of the vaccine that has been recommended so far.
Right, a very important message, of course, Professor Lee. Also, how are inoculations proceeding for foreigners here in the country, Professor?
So there had been about 15% of the late confirmed case had been of the non-Korean, of the foreigners population in Korea. But I think one of the worrying aspect is not all of the older foreigners, but those people who are more marginalized population, especially among the foreigners, and who are in working environments where they have to be congregated in the large number. And also for those people who might not be having accessibility of the information about the current COVID-19 situation and also about the vaccination. So right now, government is making a lot of efforts to have vaccination information in multiple languages, and also to, especially there are a lot of undocumented migrants, and there can be some of the migrants workers or some of the migrant populations, foreigners, who are here without legitimate documents. So for the time being, for this vaccination purpose, the government is not asking for any of the those kind of legitimate proof of residence here, but they just are asking for the identifications of their who they are. And sometimes if they do not have a visa or passport, sometimes their employer can provide their information about their names. Then it can be taken just for recording purpose for the vaccination. So the government is trying to make any of the people who are from foreign countries to be feel comfortable in getting vaccination, regardless of their legal status of staying in Korea. So I think that is some of the important aspect of the providing vaccines to the foreign people in Korea.
Right. And meanwhile, Dr. K, what are your words of advice to members of the public here to ensure a safe Chuseok holiday amid hopes for a phased return to some form of normality, that is, starting later this year?
Well, I think the personal quarantine guideline has been just the same since just the beginning of the COVID-19 pandemic. So we have to keep that kind of the guideline. And also, I think even after we are just even if in spite of some expectation to just going back to just the COVID-19 pandemic, that I think we still need some control measures such as wearing masks and then some physical distance in terms of some specific conditions. So then Well, my last word is for the upcoming Chuseok holidays, behave responsibly.
Right, to behave in a manner that will keep you and your family as well as the public safe.
Sure.
All right, Dr. Kim, thank you very much for your time today. Professor Lee, as always, thank you for your insights.
Thank you.
Right, do seek to spend a safe 5-day Chuseok holiday by choosing to shorten the time of your social gatherings and to frequently ventilate your indoor spaces. Thank you for watching. See you next Thursday.